Hi everyone, welcome to my YouTube channel. We've been discussing about MHRA inspection, laboratory inspection. And I did mention during my previous video about MHRA laboratory inspection, I mentioned that it is basically about blood transfusion. So because sometimes you might have gone for interview, like I said on my previous video, they may ask you about MHRA inspection, or they may say MHRA accreditation. Then people don't know that, because what is common that people know is about UCAS laboratory accreditation. So I've already explained that when I discussed about MHRA laboratory inspection. So if you've not watched the video, please could you just watch that, okay? Now, so in addition to the video that I've made about MHRA inspection, it will be important to also let you know that they are coming to inspect certain kind of things, which was what also a few things I mentioned on that previous video. But now in blood transfusion, to be able to work effectively in blood transfusion, you need to get used to guidelines. So these guidelines, some of them are from MHRA. So there are other guidelines that I'm going to be discussing about. However, today I want to talk to us about MHRA laboratory guideline. In fact, if I'm to be more specific, since we had already know that MHRA inspection is mostly, as it concerns to lab, is about blood bank transfusion laboratory. Okay? Now, MHRA guidelines is also a guideline that regulates blood bank transfusion laboratory or blood bank laboratory. Therefore, when I say MHRA guidelines, I'm actually referring to blood bank. So blood transfusion laboratory. So there are guidelines from MHRA that regulate this very laboratory. And they are the things that we're going to be going through today. So today I'm talking to you about MHRA blood bank laboratory guidelines. So let's get into it. Once again, my name is Dr. Emmanuel Obodo. I've been working in the UK as a specialist biomedical scientist, and I'm also a lecturer in biomedical science here in the United Kingdom. So yeah, let's start. To be able to work well in transfusion, you must get used to guidelines, and that is what makes transfusion laboratory more challenging. Unlike other departments, in blood bank, there are a lot of guidelines. And some of those guidelines, as it relates to MHRA, they are the things I'm going to be discussing. But we're going to do that gradually. So I want to start off by saying that, remember that MHRA has to do with Medicine Healthcare Product Regulatory Agency. And that was what I told you guys on my previous video, that they regulate a lot of things like medical devices. They also regulate blood and its product. I said a lot of things about that. So in terms of the medical devices, they can regulate how the devices that is used to produce a particular medicine, as the case may be. But for the purpose of this video, I'm going to specifically concentrate on blood transfusion laboratory. Now, we had already talked about analyzer that we use to produce the blood group and antibody screening. So we've also talked about the card that we use to do our antibody screening or antibody panel, cross-matching, and all of that. They are kind of device, okay? Because those things, they produce patient results. And because they have a potential to interfere on a patient result, they are a device. So they regulate all these things, okay? Now, in addition to that, do you know that they also regulate the limbs that you use because the limbs that we use in transferring those results could also have an effect, okay? Do you also know, because when you talk about the limbs, then you talk about IT system, is it now? So you now talk about information technology system then, which is the IT. So in terms of the IT system, as it relates to the patient result, how does that affect the patient result? MHRA, they are also interested about the IT. Now, specifically about the IT, I had already made a video about electronic issue. MHRA, because when we talk about electronic issue, we are saying that everything is transferred, is done electronically. That means there is no manual input on that, and everything is automatically done. And for everything to be automatically done, that means it has to do with interface between the analyzer the limbs, and how you issue the blood product to the patient. Therefore, IT system, they are involved in this very interface. Do you know that MHRA, they also regulate where the IT may possibly interfere with this patient result? So there's also IT system. So now what I want to talk about is this. In this video, I'm going to take it in 3 phases. So today, the first one I'm going to be doing, which is this video, is that first of all, I'm going to mention the phases. We're going to look at the phases in terms of, because MHRA, there are basic things that they regulate. Electronic issue. And in that electronic issue, which are, if you've not watched my video on electronic issue, but what it means basically, where we issue blood product without necessarily doing a physical serological cross match, or as the case may be, okay? So, and that means that it will require computer. It will require analyzer. It will require LIMS, that laboratory information management system. It will require a lot of technology. Therefore, MHRA, they will regulate it. So now I'm talking about electronic issue. Then, because it will require technology, they also regulate the IT system associated with that. So I'm going to group this into 3. First of all, we're going to look at the basic of this the reason behind MHRA laboratory guidelines, okay? Which I'm going to try to generalize both the electronic issue and the IT. Then after that, I'm going to look into electronic issues separately, okay? And after that, I'll look into the IT separately. The whole idea is so that I can be more detailed as I can to be able to give you guys information. So in this MHRA laboratory guidelines, I'm going to be looking at electronic issue and I'm going to be looking at the IT. But first of all, I want to generalize them by looking at the background, the overview of MHRA guidelines. So if I may title this video, I'm going to be looking at overview of MHRA laboratory guidelines. Okay? I think it will be better to start off this way. MHRA means Medicine, Healthcare, Product Regulatory Agency. Now, because remember the keyword medicine, okay? So they regulate everything that has to do with the medicine, okay? So meaning that pharmacy is associated with that, but that's not my focus, okay? I'm going to be focusing on the blood bank. Now, healthcare, then the product. So in terms of the healthcare, you are looking at a lot of things in terms of how does it concern blood bank. So in blood bank, because they also regulate blood and its product. So therefore, they are interested on how blood is being donated, the process at which the blood is being donated, okay? They regulate all these processes, okay? Now, which I did mention on my previous video, by the way. Now, in doing that as well, because a patient will be issued a blood based on the result that is obtained in the laboratory. So before we issue it, we have to do the blood group of the patient. We have to do the antibody screening of the patient. So you already know that our antibody panel or do cross match. So I did also mention that in some cases when we're issuing blood, we do what we call computer cross match, which is electronic issue. Now, knowing that, then in that electronic issue, before we can do any of this, whether electronic issue, whether it is a serological cross match, we have to do a lot of things. And those things we're going to do is not that will determine whether the patient will be eligible for electronic issue or serological cross match. I'd already discussed all of this in my previous videos, okay? So now, let's go straight into what we're going to be talking about today. Now, think about this. How do we produce the blood group result? How do we produce the antibody screening result? How do we produce the antibody panel result? We make use of analyzer, okay? We make use of ABO card group. We make use of the IgG card group, so ABO card group for your blood group and both the forward and the reverse, and also IgG card group, we use it for antibody screening and antibody panel, okay? Now, what it means then, when a patient comes, we use technology and information management system, which is the IT, to book this patient detail, book in what we want to test for the patient, okay? Now, what it then means is this. For us to produce results, there's going to be IT system. There's going to be software, maybe something like LIMS, Laboratory Information Management System, that we use in the laboratory, okay? And of course, there's going to be something like materials that we use, like the reagent or maybe devices in any form, like the card grouping I've mentioned, IgG, everything that is used in the laboratory that plays a major role on the kind of result that patient is going to get. Okay, meaning if there's a wrong technology, we can make a mistake. Again, if the analyzer is not doing well, there can be a mistake. Again, if the card grouping or IgG card is not okay, there will be a mistake. Any materials that can be used in the laboratory to determine this patient blood group or antibody status, they are all regulated. They are part of the medical devices. Now, this very MHRA, they regulate all these devices. And because they are going to regulate the devices, they also going to regulate IT as part of the devices. Because IT can contribute on the overall outcome of the patient result. Think about this. If there's an error in the IT, there could be a mistake. You see it now? So they regulate that to make sure that the IT, they function according to the guideline, according to the standard. Okay? Now, I want to start by saying that there is something that we call United Kingdom Blood Safety and Quality Regulation. I think that was established in 2005. The whole idea, it was established in the laboratory, in the hospital laboratory, which many of you are applying for job. And it's established in this very laboratory to make sure that there's going to be a quality, there's going to be standard that will reflect good practice, okay, and it will comply with the community and the commission standard. Now, when we talk about this community and commission standard, you're going to be hearing something like, of course, MHRA can be there in terms of the commission. There's what we call BSH, and there's also what we call BSCH. They are mostly the same, but BSH talk about British Society Hematology Guidelines. Now, when you look at the BCSH, British Committee for Standard in Hematology. So what it then means that in producing these guidelines, MHRA, while is establishing the guideline, is working together with this British Society, hematology guideline. So they work together to make sure that this laboratory, this hospital laboratory, they function according to the standard. So anyway, like I've said, I'm going to first of all talk about the overview of this. So from the background I have laid, you are going to see that the motivation of the MHRA is this. How is your IT system doing in making sure that you produce a good result? The material that you use in producing this patient result, how standard it is, okay? Have you confirmed that it is standard? Has it been validated and all of that, okay? The process that is used, has it been regulated? So these are the things that the MHRA is regulating. So anyway, now let's move into the overview of the MHRA laboratory guideline, okay? So from what we have said so far, what could prompt MHRA? When they come for inspection, what are the kind of things they're going to be looking at, okay? And what could actually prompt them for inspection? Anyway, one of the things they're going to be looking at is this. Now, is the electronic issue working according to the guidelines? So they are the kind of the thing they are actually going to be looking at. Remember that I said that if electronic issue is going to work according to the guidelines, analyzer has to be working well. The technology, the IT system, whether the internet, everything you are using, every devices, because electronic means that everything is done electronically. And for issue blood electronically, everything that has to do with the electronic system, including the IT, including the analyzer or the internet, whatever, they have to work very well. From the beginning to the end, everything has to be electronically done. So is it working according to the standard? So they are the kind of things they are going to be looking at. Another thing they will look at is this. The relevant guidelines given by this very BSCH or BSH guidelines, okay, in terms of the blood bank and computing, is the laboratory maintaining the standard? We will look into all of this in detail, so don't worry, I'm laying a background, okay? The next thing is this. What could be the problem with IT? What could be the problem with the analyzer? When we talk about electronic issue, if everything is going to be done electronically, what could be the problem here? A procedure may fail, okay? So, and once a procedure fails, that means then it's going to affect the overall result. Because remember, we're talking about electronic issues, so we want everything to be done electronically, and we don't want anything interfering to it. One of the things that could interfere to it is if the procedure fails. Another thing that can affect it is if the laboratory information management system, like LIMS, okay, is not functioning properly. Of course, in the laboratory, sometimes we do have what we call downtime, okay? I think I should actually make a video on downtime. So, during the downtime, maybe the downtime could be the software, could be the LIMS, is down. So something like that, once the limbs is down, it will be hard then to maintain electronic issue. Even if the result, the analyzer is working well, it has done the blood group and antibody screening, everything is done electronically on the analyzer, okay? For the fact that it cannot transfer the result to the limbs, your chances of doing electronic issue will be dampened. And therefore, you now see that once the limbs is not functioning very well, if there's a faulty in the limbs as a result of maybe downtime, as the case may be, anything that could, make the limbs not to function very well, could as well affect the overall electronic issue. Again, which is also could be IT, associated with the IT. You see it now, okay? So we've mentioned the procedure failure. Now we've mentioned the limbs not functioning very well, okay? Or maybe the limbs being down. One of that is they also want to check, or one of the reasons why they give these guidelines about this very electronic issue or IT, like we're going to discuss in detail, is they also want to make sure that the system, the procedure, or the processes, okay, the equipment that you are using that are involved in the electronic issue, such as your analyzer, the limbs and everything, has been validated, have been verified and validated. If you've not watched my video on the reason why we validate or verify a reagent or materials, you go and watch video on that. So they want to make sure, have you validated this very software? Have you validated these very limbs? Have you validated the analyzer? Have you done any of all of this? Is you need to show evidence for it. They are doing this to make sure, with the help of the guidelines, you will know when to do electronic issue. Of course, you will know when to do serological cross-match. So this is why they are important, okay? This is why they are there. Because if this administration is not in place to checkmate these processes, of course, that would then lead to the inherited high-risk oppression, which will not be good. So to summarize that, the guidelines is also trying to make sure that we are aware of when to use electronic issue and when to do a serological cross-match. And if we're going to do electronic issue, there are processes that has to be in place and it has to be complete. And of course, if those processes, if anything happens to that processes, or if something happens, make a patient no longer to be eligible for electronic issue, we then need to also have another guideline that would now support the serological cross-match and all of that. Okay, MHRA work together with this BCSH guidelines, to regulate this very blood bank, transfusion laboratory in terms of the computing, in terms of the procedure of their testing, and in terms of the blood safety and quality regulation. Another reason could be lack of validation to verify the effectiveness of the standard measure that you believe to be in place. In other words, remember that before you use the analyzer or before you use a quality control, anything, those things have been validated, okay? That's the reason for these guidelines, to make sure that electronic issue conform with this. Okay, so they want to see the evidence that you've validated a process, okay, or a system that give you confidence that the standard that you believe to be in place is actually in place. Okay, so these are one of the things that they look at. Why is this important? It is important because all these processes that they really want the laboratory to make sure that they put in place is because if it is not in place, it has a potential of giving a wrong result. And if it gives a wrong result, it means that we may issue a wrong blood product to a patient. Imagine someone who is A positive, and because of the lack of the effectiveness of the process not being verified, and you think the person is B positive, and you give the person B positive blood, that would be a very hazard situation. Okay, so that's why MHRA regulates this. So they do that because these processes, if it is not properly regulated, okay, could potentially lead to the giving out a wrong result or issuing a wrong blood product to a patient. And that means that it can lead to supply of the incompatible blood unit to a patient. And that will not be fair. That will not be good because, of course, that might lead to, death and a lot of conditions or situations that may not be good for that patient. Now, another thing that they look at is this. Remember that when we look at electronic issue, which is a computer cross-match, we don't necessarily do a physical or serological cross-match, okay? But remember, they put these guidelines as well in place because if we concentrate only on electronic issue, that would be a very hazard. So in other words, electronic issue without a serological cross-match put in place, meaning you need to know when to do electronic issue. You also need to know when to do serological cross-match. If all we focus is electronic issue, that will not be good because that will be an inherited high risk oppression, and that will not be okay. Because of that, there is administrative processes involved. And of course, this is also where MHRA, BSH guideline or BSCH guideline work together to put out this very administrative, robust situation to make sure that these things are checkmated and that they are put in place to ensure that inherited high-risk operation will not occur. Okay, so that is why, as we dive into it in detail, you are going to see that electronic issue, which I'd already mentioned in my previous video, does not occur all the time. It is not all patient that is eligible for electronic issue. Now, I'm going to give us the overview of MHRA electronic issue guidelines. But before I do that, I'm going to make another video for electronic issue guideline. That is where I'll go into detail. But let me give you this very background for you to understand something. Now, before we issue a patient blood, there are many things that will happen. Number one, we had already discussed, do we have, current group on this patient? Do we have a history group? Do we have a history of antibody and all of that? Okay. In some cases, okay, we can also issue blood even when we don't have any of those things, okay? So meaning there are a lot of guidelines involved regulating how we do what and when we do them. I'm going to look at that in detail. Another thing I also want to say is this. There are some laboratory that they cannot necessarily do electronic issue. Because in some of these laboratories, they don't have analyzer that can perform blood group and antibody screening. So they would then have to do their blood group and antibody screening manually. They also would then have to do their cross-match, of course, the cross-match then manually. So those laboratories that don't have analyzer to do automated blood group, there cannot be electronic issue in that such hospital or laboratory. You see it now. So where electronic issue comes in is where everything is done electronically. From the point of booking in the sample to the point of analyzing the sample, transferring the results, okay, to the laboratory information system. So because of that then, MHRA strongly recommend electronic issue. And in doing that, they recommend for automated pre-transfusion testing, that it should be used where possible. So not the word where possible. Where possible is this. So even though they recommend for automated pre-transfusion testing where possible, it may not be possible for other laboratory, other hospitals that does not have analyzer. Once they don't have analyzer to process that blood group and antibody screening, no patient that attend that hospital will be eligible for electronic issue. So that is why their guideline is they recommend for automated pre-transfusion testing where possible. And this process must have followed the security and the validation processes and the procedure that has already been validated to show that that processes they work. Okay? In manual testing, especially in electronic issue, one of the guidelines that they give is that you must control that process, the whole process involved, both in the manual testing, but more importantly in the electronic processing, to make sure that any possible risk that may be associated with any of the process will be detected. I'm going to give you an example, okay? Sometimes when we look at this electronic issue, there's a lot of things that happen. When you start working in the lab, you're going to see that there's a lot that happen. Let me give you an example. Sometimes, analyzer might give you a false positive antibody screening result. How are you going to know? How are you going to know that you have verified the process? There are things that you put in place to check, to understand when it is, a real result and when it is not a real result. Remember that this analyzer, they are not human. In other words, they can make mistake. So I'll give you an example. Sometimes in the IgG card tube, even with the ABO blood group card, okay, there can be a kind of maybe a hair, it could even be human hair, it could be anything that is there, okay, or it could be maybe when it's pipette and bubble or something like that. Anything could make it to give you a false result. Okay, so before you release that result electronically, you've checked it, and when you've checked it, okay, because the process have been validated, that when you see such bubble, which analyzer have called positive, or you've seen such any kind of thing that has been validated, okay, you've seen such information that has been validated. So if you go to each of these very laboratory, we have a lot of errors that analyzer can give you, and also we have a lot of things that you can check to determine what you are going to do or what you are not going to be able to do. Okay, so there are sometimes it might give you a result that has been validated that you need to repeat it. Okay, you see it now, because the process has been validated, and when you see such thing, repeat it, you repeat it. And also there are some things that have been validated that when you see such thing, don't bother to repeat it, do this. So you have to make sure that that process, especially when it has to do with the electronic issue, have been so much controlled that any potential error, any potential mistake that may be produced will be detected. Now, in summary, you can now see how the IT, information technology, LIMS, okay, both the analyzer, the equipment that use, everything, how they come together, to support electronic issue guidelines, which is being stipulated by this very MHRA. We're going to look at them in detail. What I've given to you so far on this video is overview of it. Now I'm going to look at it in detail because I want to take my time, you see, to make sure I give you guys detailed information about this. Because when you get it right, when you go for interview, when you answer question and they ask you why, you can be able to produce the why. And that is why I want to take it, gradually. So far the overview is this. MHRA in combination with BCSH guidelines is more interested about how a patient result is being produced and how does that lead to the result, the blood that we may issue to the patient. Was it done electronically or was it done manually? If it is done electronically, there's a lot of things that you have to check: the IT, the LIMS, the analyzer, the materials, and all of that. Okay, if it is also done manually, we're also interested about the manual process that is being used, the material that is also used. So these are the things that they are paying attention, and the overview of it is to make sure that when we issue a blood to a patient, we are issuing a good and a reliable product to that patient. Because if there's any mistake with the analyzer result interpretation, if there's any mistake in the result that the analyzer produced, if there's any mistake with the LIMS, if there's any mistake with the IT or any of these technology processes, it can affect the services that we're going to render to the patient. In other words, it may lead to the possibility of issuing incompatible unit to a patient, and that will not be good. So next time, I'm going to go straight to electronic issue MHRA guidelines. And after that, I'm going to look at MHRA IT guidelines. So these are the two main guidelines that this very MHRA gives. There are other guidelines which from this, it will lead me to all of those guidelines. Don't worry, I'm going to take you guys to each of these very guidelines, then you master the guidelines, because for you to work in blood transfusion, one of the things that you must know here is the guidelines. Because everything that happens in the blood bank has guidelines. There's a guideline for what you do. Even if I've talked to you guys about concessional release form and all of those things that I've talked to you guys about historic antibody or these are guidelines. We're going to look at them in detail as we move into it. But anyway, here you go. This is the overview of MHRA guidelines. If you do have any question, please put it on the comment section. And of course, let me know how this video has helped you, or what you think about the video. Thank you very much till I come back your way again. Bye-bye.